we haven't met before, I'm Amy Labby. I wanted to talk today about some of the things that I've been able to heal on a meat-based diet. So I will be 50 years old in July. I started a keto diet 5 years ago because I had weight that I wanted to lose. I'd like to say that I started that to heal all of the issues I had going on, but it was really the weight that brought me to it. I did keto for a couple of years, and now it's been 3 years of carnivore. So I started with migraines at 12 years old, debilitating, that got increasingly worse as the years went by. I've been on multiple medications to prevent them and then to treat them when I would get them anyway. I went from having a headache daily in high school, every single day after lunch I had a headache, to after my kids were born and in my later 20s, starting with years of 3 or 4 migraine days a week that I would wake up in the morning, be in intense pain and working like that, vomiting, being at work, taking care of patients, just absolutely miserable. And that went on for years and years and years. I also was diagnosed in my 20s with Crohn's disease. I had chronic gut infections, C-diff infections, multiple courses of antibiotics, constant abdominal pain and bloating from the probably when I was 4 or 5 years old. I remember just having chronic diarrhea and constant stomach issues. That went on until my late 30s when my gastroenterologist wanted to do a fecal stool transplant as I was being hospitalized and there for 3 or 4 weeks at a time on IV antibiotics. And I really, I just refused to do that. So the other things that I dealt with were seasonal allergies from a very young age, just miserable from them, constant eye infections, throat infections, strep throat, pneumonia, ear infections. It was just constantly something like that. And until the last 5 years or so, I was always on medications for allergies and all that kind of stuff. And also antibiotics to treat, the strep and the ear infection and the, draining eardrum and just constantly things like that. Conjunctivitis. I had eye infections all the time. I couldn't get around one of my grandkids without having conjunctivitis after. I would say also, metabolic wise, as far as symptoms, I had malignant hypertension from the time I was in my late 20s, on 3 different medications for that by the time I was 30. Frequently go into the doctor's office or be in the hospital and have a blood pressure of 200 over 120. Just fluidy, like you could look at me and tell that my blood pressure was high, red face, all that kind of thing. Also obesity, insulin resistance, inflammation, joint pain, back pain, everything hurt. Brain fog, fatigue. I would also, as far as mental health, just depression from a very young age that increased over time. Anxiety, obsessive thoughts and cravings, binge eating, food addiction. These are all things that have righted themselves over these last 5 years of getting rid of first the processed foods, going to a whole diet, being in a state of ketosis, and then switching to animal-based. And honestly, I would just do keto all the time, except that the veggies kept my Crohn's disease in I just couldn't get rid of all the symptoms. The fiber was just still killing me. I was bloated still all the time and had periods of pain. I was much better, but I just couldn't get to that full relief. And when I took out the vegetables, I mean, there just was no comparison. And I was like, you know what? I'm as heavily meat-based as I can be without being full carnivore. Let's just do it. And that's what I did. I have a migraine now probably once every 3 months, and it's usually seems to be related to barometric pressure and weather patterns. I only wake up with them now if all of a sudden, you know, it started raining during the night, or yeah, there's a lot, you know, it's always weather related. It's not clearly not related to what I'm eating. If I have something sneak in, something processed, or, you know, I've had times in the past where I've had binges, I immediately have a migraine. So very food related. I am off 12 medications now. I was medicated for all of the things that I talked about, my allergies, infections, chronic pain. I took Neurontin for nerve pain. Protonics for 20 years, proton pump inhibitor for GERD and acid reflux. That's gone. Prozac for my depression. That's gone. Topamax. I took that for migraine prevention for 15, 20 years. I don't even know how long. And all of those things are gone. I can't even think of all the things I was on now. I remember getting up in the morning and that was my breakfast, a big cup of pills. And I take some supplements now, magnesium, fish oil, but no medications. And my whole life has changed. My whole life has changed. I'm not exhausted. And I would just say that the greatest thing is just waking up and feeling happy in the morning. You know, not this sense of, oh my God, you know, being in pain and having chronic pain, I'm sure as many of you know, there's a mindset attached to that of, or there certainly was for me, of, I don't know what's coming tomorrow because it's going to depend on what I feel like. I don't have that anymore because I always wake up and I feel good. And if you don't know what that feels like, I wish that you would message us. I wish that you would message us at Beyond the Scale. Stephanie and I are working with people all the time who are in the same place that you are, who are in the same place that I was in. And we just want to help you. We just want to turn this around for you. If you're food addicted, I mean, that was the story of my life. I didn't think I could ever stop craving things. And that's where I am now. And I'm not saying it's not hard work. It is extremely hard work. Because guess what? When we stop soothing ourselves with whatever substance it is, and it can be anything, alcohol, drugs, behaviors, sex addiction, food addiction, processed food addiction, eating disorders, sugar addiction, those are all in response to what's going on in here. And we need to work on those things. And when you take those substances away, those feelings come back. We need to work on that. We need to work on the person that might have been had all of these things not gotten in the way. And you know what? Our brain was just protecting us. It was just protecting us from the hurt. We want to help you with that. Please message us. And you know what? I'd also like to say, before I get messages about, you know, you're spreading misinformation and on, this is what worked for me. I'm not telling you what to do. I'm not giving you advice. If you want to hear what we've done to change ourselves, we'd be happy to talk to you about that. And we'd love to hear your story.